The world of medicine can feel like a whirlwind of information, especially when it comes to something as crucial as cardiovascular disease. You're bombarded with complex terms, endless drug names, and confusing research. It's overwhelming, to say the least. But what if we could simplify it? What if understanding essential medications like beta blockers was as easy as reading a news article? That's exactly what we're aiming for here. In this guide, we'll break down the complexities of beta blockers into digestible pieces. We'll explore how they work, their benefits, and how they differ. By the end, you'll be well equipped to navigate the world of beta blockers and understand their vital role in managing heart health. Think of this as your crash course, your cheat sheet, your backstage pass to understanding these powerful medications. Let's demystify beta blockers together and empower you with the knowledge you need. Ready to dive in? Let's get started. Imagine your heart as a race car. It needs to beat faster in certain situations, like when you're exercising. That's where adrenaline comes in. It's like hitting the gas pedal, making your heart pump harder and faster. Now, sometimes this racing can be too much for your heart, putting extra strain on it. This is where beta blockers step in. They act like brakes on your heart, slowing down the effects of adrenaline. This helps to lower your heart rate and blood pressure, giving your heart a chance to relax and work more efficiently. But beta blockers aren't a one-size-fits-all solution. They come in different models, each with its own set of features and benefits. Some are like high-performance brakes, designed for specific situations, while others are more like everyday brakes, suitable for long-term use. Understanding these differences is key to choosing the right beta blocker for each individual patient. So let's meet some of the star players in the world of beta blocker medications. In the world of cardiovascular medicine, there are a few beta blocker superstars that stand out: bisoprolol, carvedilol, metoprolol, and nebivolol. Each of these medications has its own unique profile and strengths, making them valuable tools for managing different aspects of heart disease. Think of bisoprolol as the reliable workhorse. It's known for its long-lasting effects, meaning patients often only need to take it once a day. This makes it a convenient choice for long-term management of conditions like high blood pressure and heart failure. Next, we have carvedilol, the multitasking marvel. Not only does it block beta receptors, but it also has antioxidant properties which can be beneficial for protecting blood vessels from damage. This makes it a popular choice for patients with heart failure who may benefit from additional cardiovascular protection. Metoprolol is the versatile veteran. It comes in both immediate release and extended release formulations, giving doctors flexibility in tailoring treatment to individual patient needs. Metoprolol is often used to manage high blood pressure, angina, and to reduce the risk of further heart attacks in patients who have already had one. Finally, we have nebivolol, the smooth operator. It's known for its gentle effect on blood vessels, which can help to improve blood flow and reduce strain on the heart. Nebivolol is often prescribed for high blood pressure and may also be beneficial for patients with certain types of heart failure. Understanding the strengths and weaknesses of each of these star players is crucial for making informed treatment decisions. Clinical trials are like the proving grounds for new medications, where researchers put them to the test in rigorous, controlled settings. These trials are crucial for understanding how effective and safe a medication is, and they often involve thousands of patients over many years. Let's imagine each of our beta blocker superstars as superheroes undergoing their trials. Bisoprolol, our reliable workhorse, might be likened to Superman in the CIBS-2 trial. Bisoprolol demonstrated its strength by significantly reducing the risk of death and hospitalization in patients with heart failure. It was like Superman swooping in to save the day, providing long-term protection and improving survival rates. Carvedilol, the multitasking marvel, could be compared to Wonder Woman. The Copernicus trial showcased carvedilol's exceptional abilities, showing that it not only improved heart function but also reduced the risk of death in patients with severe heart failure. It was like Wonder Woman using her strength and compassion to fight for the well-being of her patients. Metoprolol, our versatile veteran, might be like Batman. In the MERIT-HF study, metoprolol proved its effectiveness in reducing mortality and hospitalizations in patients with heart failure. Just like Batman relies on his gadgets and strategic thinking, Metoprolol's different formulations allow doctors to tailor treatment plans effectively. Nebivolol, the smooth operator, could be compared to the Flash. The Seniors trial highlighted nebivolol's ability to lower blood pressure and improve heart function in older adults with heart failure. It was like the Flash using his speed and agility to efficiently manage blood pressure and protect the heart. These trials, like epic superhero battles, provide valuable insights into the real-world benefits and limitations of these medications. Section 5, Real-World Rescue. Beta blockers in practice. Let's step away from the world of superheroes and into the real world of patient care. How are these beta blockers used in everyday medical practice? Imagine a patient named Sarah, a 65-year-old woman diagnosed with high blood pressure and early signs of heart failure. Her doctor might prescribe bisoprolol due to its long-lasting effects, making it easier for Sarah to adhere to her medication schedule. Now consider John, a 70-year-old man recovering from a heart attack. His doctor might choose metoprolol to reduce his risk of another cardiac event. The doctor might even opt for the extended-release formulation to ensure a consistent level of medication in John's system. Then there's Maria, a 55-year-old woman with heart failure and a history of migraines. Her doctor might recommend nebivolol due to its favorable side effect profile, as some beta blockers can worsen migraine symptoms. These are just a few examples of how beta blockers are used in clinical practice. The choice of which beta blocker to use depends on a variety of factors, including the patient's specific condition, medical history, other medications they're taking, and potential side effects. The key takeaway here is that there's no one-size-fits-all approach to beta blocker therapy. It's about finding the right fit for each individual patient to optimize their cardiovascular health. Section 6, Beta Blocker Basics. Your quick recap. Let's take a moment to recap what we've learned about these important medications. Here are the key takeaways. Beta blockers are like brakes for your heart. They slow down your heart rate and lower your blood pressure, which can help your heart work more efficiently. Different beta blockers have different strengths. Some are long-acting, some are multitaskers, and others have a gentler touch. Clinical trials are like superhero training grounds for medications. They help us understand how well these medications work and if they're safe. Choosing the right beta blocker is like finding the perfect pair of shoes. It depends on your individual needs and circumstances. Now imagine yourself explaining these concepts to a friend or family member. You'd be surprised how much you've learned in just a few minutes. Section 7, your beta blocker cheat sheet. We've covered a lot of ground today, and it's always helpful to have a quick reference guide for future use. That's why I've created a one-page PDF cheat sheet summarizing the key points about beta blockers, including mechanism of action, how beta blockers work in the body, types of beta blockers, key differences between the star players, clinical uses, common conditions treated with beta blockers, side effects, potential side effects to be aware of, drug interactions, important interactions with other medications. This cheat sheet is designed to be a handy resource for you to review and refresh your knowledge whenever you need it. You can download the cheat sheet for free by clicking on the link below. Keep it handy and refer to it whenever you need a quick refresher on these important medications. Section 8, the journey to mastering beta blockers. Congratulations, you've taken a significant step towards mastering the world of beta blockers. You've learned about their mechanisms, key players, clinical trial evidence, and real-world applications. Remember, this is just the beginning of your journey. The more you learn about these medications, the better equipped you'll be to make informed decisions about your health or the health of your loved ones. Continue to ask questions, seek reputable sources of information, and engage in conversations with your healthcare providers. Knowledge is power, and when it comes to your health, there's no such thing as too much knowledge. Keep learning, keep exploring, and keep advocating for your health.